Dr. Doyle. I just wanted to briefly tell you about the Doctor of Nursing Practice program. I just wanted to also tell you what it really is about. It's a terminal degree in nursing. We now have an option between a research doctorate and a practice doctorate. So the practice doctorate is really focused on people who want to work in practice, stay in practice. Came about really from the fact that with the increased complexity of healthcare, there were new competencies required of advanced practice nurses out there, genetics, evidence-based practice. Those all were added to master's programs, and before you knew it, the credit required for master's programs was looking like a doctorate, the course load. So with that and with organizations really looking at it and seeing a need for a doctorate that's a non-research doctorate, a practice doctorate from the National Academy of Sciences, from recently the Institute of Medicine, which was recommending in its future of nurses that we increase our education levels. The DNP has evolved. So what would happen here, the Columbia program is a clinical doctorate. It's really focused on clinical practice. You would go through a primary program. We have a post-baccalaureate option and a postmaster's option. So these courses can start to be incorporated during the master's program. So you'd have to meet with me to let me know about that so we can work that out. That will decrease the amount of time to graduation through the DNP program. You can complete the master's program. You can get your certification as a nurse practitioner. You can start practicing. And as you complete the DNP program, the courses are all on Fridays. They accommodate a working schedule. There are, the jobs you get out there will be the jobs that your population foci. If you're an adult geriatric nurse practitioner, those are the jobs you'll be looking at, whether you're a DNP prepared or not. Those are the jobs out there for that. Certification-wise, again, certification is required after the master's for practice, depending on your population. There is a DNP certification exam out there through the American Board of Comprehensive Care. It would make you a diplomat of comprehensive care, and it basically, although not required, after this program, what it would say is that you're an expert in comprehensive care. So DCC certification, this program really sets you up for that certification exam.
What we do in the anesthesia program is we prepare novice generalist nurse anesthetists that have entry-level expertise, and this is going to run through a little bit of a series of things here, but we do cost-effective peri-anesthetic care and patient management across the lifespan. So experiences are going to include OB, peds, neuro, cardiothoracic, general, and many other subspecializations within surgical and anesthesia practice. So what you learn in the ETP program is a really important foundation for anesthesia practice, because nursing education is a generalist education, just as anesthesia is. Now, some people think that because we stick tubes in and pull tubes out, that we are somewhat of a technical specialization or role within nursing, but I think that's absolutely not true. We are really peri-anesthetic primary care providers. We manage patients. They don't leave their hypertension at the door. They don't leave their diabetes at the door when they come for anesthesia. We manage these patients through that period of time in the context of their disease and family and all those types of things. So we have about 35 clinical sites, and they are up and down the eastern seaboard, as far south as Maryland and as far north as Connecticut. Most of our sites are located in the metropolitan area. So we have a metropolitan area, but in the New York area. And students who travel distances generally do so at will, or as a preference. So we have some sites are dedicated sites where the student spends the majority of their time at a specific site, whereas other sites are rotation. So a student would spend a few months in each site and rotate to different sites. So successful completion of the nurse anesthesia program confers eligibility for the national certifying exam, and then students who pass the certification exam earn the credential CRNA, which is a certified registered nurse anesthetist. Our first-time pass rate on the certifying exam is about 96%, not because our students aren't capable, but perhaps sometimes they aren't sufficiently prepared. But our second-time pass rate is 100% for the last 5 years. Okay, and the scope of practice. That's an interesting question, and scope of practice does vary from state to state because state legislatures are responsible for determining that scope. However, our responsibilities for patient and our accountability to the public is the same no matter where you go in the United States. So we educate our students to be accountable and to be responsible for the care that they provide. Let's see, what else do I want to do here? We have a 100% graduation rate. Employment rate after graduation within 6 months. And I think that's it. I think I covered all the bases that I want to, but I want to reiterate one thing, and that is that baccalaureate education, your nursing education is a foundation for advanced practice because it's across the lifespan and it's a generalist perspective. So if you're interested in anesthesia, make sure that you give weight to what you're learning in the undergraduate portion.
Pediatric nurse practitioners are primary care providers for children from birth until the age of, according to the association, the National Association of Pediatric Nurse Practitioners. It's birth through 21. The program here prepares you is focused on primary care. You will have opportunities to do some specialty care within the pediatric population, but it follows a developmental timeline. So you take care of infants, toddlers, preschoolers, school age, and adolescents, and then the sicker children that cross those time frames. You'll learn a lot about growth and development as it applies to pediatric primary care. And as Dr. Desjardins mentioned, and thankfully, most children are well, but the PNP that focuses on keeping them well, keeping them immunized, keeping them understanding what's coming down the pike and giving a lot of anticipatory guidance. You're dealing with a family, you're dealing with a mother and a baby, and then eventually you are dealing with the patient directly when there's an adolescent, and there are a lot of nuances as you make the transition and as patients make the transition from dependence in a family situation to some independent decision-making about their own health care, and that happens in adolescence. So if you're interested in adolescence, there's a lot of depth in that period of time in the PNP program here, and I think in general PNPs. There are many that focus and get very, very well-educated, in-depth education about adolescent health care, which can be quite complex. Job opportunities are good, very good. It's my understanding from Dr. Hall that within the spring semester, you graduate in the fall, and during that spring semester, by the end of that springtime, all of the students are certified, licensed, and by June, it's my understanding they're employed. And I think the principles that were mentioned earlier are true. There are jobs, but you have to have a job that fits. So if you're interested in a certain age group, then you will focus on jobs there, and it may be harder to find the right fit for you. And I do agree that you need to be in an environment where you can't get validation at the beginning, because you're going to need that. You're a beginner level, an excellently prepared beginner level PNP when you graduate from the program, which occurs in the fall. So you start in the summer, following ETP, you go summer, fall, spring, summer, fall, graduate. Sit for certification and get licensed and look for a position. And it's in that period of time that you can jump into the DNP.
What age group does this entail? So because that's determined by the State Board of Nursing, we have to teach you from the youngest to end of life. So it includes late adolescence, which could be 14, 15 years old till end of life. In New York State, an adult is defined by age 18. Our certifying body just combined to make one certifying body, and that's called the ANCC, the American Nurses Credentialing Center. And as Dr. Honig had said, when you complete the program, you are eligible to sit for that exam. As far as clinical sites, We have a lot of clinical sites, mostly in Manhattan, some in the Bronx, some in Brooklyn, and a few in Queens, and a few in New Jersey. There are outpatient, inpatient, it could be in a specialty practice, or it could be in primary care. All of these, and I tell all of my students going into their first clinical, it doesn't matter if you are in a specialty practice, because there's primary care that can be extracted from every clinical site and every clinical experience. So some of the primary care sites would include CAPNA, which is the Columbia Advanced Practice Nurse Associates practice, and we're located, I'm one of the practitioners there, and I always take students as well as my colleagues there. We have private practices, geriatric practice, student health, occupational health, community health clinic, women's health clinics, and there's HIV, for specialties, HIV, ID, infectious diseases, cardiology, dermatology, hepatology, other GI, and orthopedics. So there's quite a bit of a range as far as clinical opportunities. As far as clinical hours go, you would start, just like the pediatric program, you would finish in the summer, May, and you would have that time to pass NCLEX, and then you would start didactic work in the summer, and then in the first fall you would have your first clinical, and that's as a group, and then in the following spring you would be set up, for the following spring, summer, and fall, you would be set up one-on-one with a preceptor. And what I like to do is I like to give a nice range of experiences, so some may be inpatient, some may be outpatient, some may be specialty, and some would be primary care.
That a lot of students ask about what type of jobs they can get after graduation, working as an acute care NP. Most graduates primarily work in the hospital setting, either in an intensive care unit. We have more and more graduates who are going into jobs in the emergency departments. So that's a growing field. And also, in addition to that, many specialty services, as Kristine talked about with the adult program. Within the hospital, as everything is so specialized, in addition to jobs in the critical care unit, you could get a job with, for example, the chest pain service, where you would be working with a cardiology team, and you would be traveling throughout the hospital, taking care of patients, wherever an incident occurs. So there are different types of jobs that are situated in one location, as well as a specialty team that you round with the team and you see your patients wherever they are. If you work for the liver transplant team, you might start out in the morning rounding on patients in the intensive care unit, then in the step-down unit, and maybe even to some degree following patients in clinic at the same time. So the scope of practice, which was recently redefined, is not based on the location so much, although I would say probably the overwhelming majority of jobs are in the hospital, but there also are outpatient settings where you can work as an acute care NP with that very sick population. A heart transplant clinic, some of the oncology outpatient jobs. And in fact, the oncology subspecialty that we have, a lot of our acute care NPs take that as well, and that's a nice combination. So that's just a little bit about the kinds of jobs that people get. The job market is very good. In terms of our certification, there are now 2 organizations that certify acute care NPs. Both exams are very highly regarded, and our pass rate is 100% for passing that certification exam. So the one thing that I would recommend, highly recommend, is something that is unique about acute care is that this specialty, we're an advanced practice. As Judy said, all of the specialties we're all advanced practice nurses, but the acute care specialty really grew out of that hospital and that critical care setting. And having experience in that setting as a nurse is critical to your getting a good job when you finish the NP program. So I don't think we're requiring it right at this moment, but I would strongly, strongly recommend that you plan from the beginning. If you choose acute care, that you're going to take that year off, work as a nurse, either in a critical care unit or, as Dr. Desjardins said, you could get a job in a step-down or a telemetry unit. The acuity of our patients is so high that, you know, that would be valuable experience. And we don't need you to have 10 years experience. The learning curve working in that kind of setting is very steep. So in 1 year, you're going to learn a lot, and you're going to come back much more prepared for the acute care NP program, and you will be much, much, much more marketable at the end.
Our program will prepare you to sit for the certification exam for AMCB, American Midwifery Certification Board. And we prepare you to provide well-woman primary care to women throughout the lifespan, so during the childbearing years and beyond. Technically, that's defined as age 14, I believe is the low end, up to 45 are the childbearing years. Certainly, we see women seeking out midwifery care and getting midwifery care at younger ages, and then beyond childbearing as well, so through the perimenopausal and menopausal years. We have, in order to prepare you for that, we do have specialty didactic and clinical rotations that cover all of that content. So preconception through antepartum care, labor and birth care, postpartum breastfeeding, newborn, and then on through the well woman primary care portion. So there's didactic and clinical rotations for all of those. The midwifery year is essentially 4 semesters: summer, fall, spring, and summer. We begin right after this ETP year ends. So you complete the program in mid-May, and then when the summer semester begins, you begin the midwifery specialty, which is primarily didactic courses, and we have 1 clinical laboratory course, which is the pelvic examination course that prepares students to then go into the clinical rotations with one-on-one precepting, not always the same preceptor every day, but one-on-one precepting with a certified midwife or a certified nurse midwife for your fall rotations, which would be antepartum care and well woman care. And in that well woman care rotation, that's where you would do preconception, postpartum, family planning, counseling, and initiation of family planning methods, well woman care, and some well woman primary care. So we include all those competencies. The spring semester, the specialty courses in clinical involve breastfeeding postpartum, newborn care, and intrapartum care, which is the labor and birth portion. All of that exposure you get in the 1 basic semester of your hospital placement, the labor and delivery rotation. And again, that's with one-on-one precepting. Those are the basic rotations, and all of those clinical rotations happen in the metropolitan area, primarily in Brooklyn, Queens, and Manhattan. We always have 1 to 2 Westchester sites and 1 to 2 New Jersey sites. And those are all considered our home base sites. Then for the final clinical semester, which is integration, all students are expected to perform still at a basic level in terms of midwifery practice, but at a slightly more integrated and advanced level than from the initial basic rotations that I just described. So all students will then be in clinical sites working as a full scope midwife, working whatever schedule a midwife works in that practice. This is the only rotation where we have sites outside of the city, where you would go somewhere else altogether, away from the metropolitan area. This is the only situation where we have students, -1. This is the only situation where we have students possibly on call, possibly in private practice, possibly in out-of-hospital birthing situations. And those assignments are made in a very, very, very careful and thoughtful case-by-case basis. So not everyone leaves the city, not everyone is out of hospital, and we would certainly never send anyone who didn't want that kind of experience. So we do meet with you. The faculty, the midwifery faculty meets with students during the ETP year that are either accepted into the midwifery program or interested in being on the wait list. We meet probably every 4 to 6 weeks to discuss a lot of the things that I just talked about, to give you more ideas of the overview of the year, what you might expect during the master's year. We also do that in order to help facilitate one of our additional requirements, which is labor support experience that you would get during the ETP year, and we facilitate that for you. This is one of the reasons why we are not that concerned with having that one-on-one 8-week assignment being labor and delivery for those of you that are going to be in the midwifery program. As Dr. Justardon said, there's a lot that's very different between being an L&D nurse and between being a midwife. And there's not a lot that you're really going to learn about what it is to work with laboring women when you're performing a nursing role on a labor and delivery unit for an 8-week period of time.
Our PhD program here at Columbia is meant to develop nurse scientists who will contribute to developing knowledge that's important for the health of populations. And traditionally, nurses entered PhD programs after doing, having clinical careers, and I can speak to that because I was one of them. But what we've really learned about that is that that's really not the right way to go. And really developing nurse scientists after they've had a beginning foundation, and the beginning foundation is what you'll be doing during the year of ETP. And so let me tell you a little bit about what that might look like. Following ETP, and similar to what everyone else has told you, generally it's something we'd like you to think about if you think this might be good for you, to think about it during the year, because generally people apply to PhD program in the beginning of January, and we make our decisions around this time of the year. We'll be coming back to you in town hall meetings, and we have open houses and things like that. So this is just a beginning little snippet. But so if someone, if you were interested in becoming a nurse scientist, what you would do following completion of your ETP program is that you would seamlessly enter a PhD program. What that typically involves is 2 years of coursework, okay? And that coursework is certainly research methodologies, both quantitative and qualitative, coursework that would support your research idea. So those might be courses at Teachers College, it might be courses in sociology and School of Public Health. It can be in a variety of different places depending upon what your area of focus is. Following, and certainly courses in theory and measurement. Following completion of those 2 years, we have a comprehensive exam that really is meant to see if students have synthesized what they've learned, and this is a written exam followed by an oral defense of the exam. Once that portion is completed, then people progress to their own very individualized dissertation project where they conduct research that they have planned in conjunction with their advisor. When students are accepted to the program, they're assigned an advisor right in the beginning. And we do that because we want people to become not only take courses, but become enculturated in the role. And how do you do that? Every semester, you participate in research. It may not be your own research. You're going to be doing that during your dissertation project. But you'll begin to participate in research teams to begin to develop your toolbox and see what is life as a researcher like. What are the what things do we do when you don't see us in the classroom? And so we think those experiences are very important, and you'll do an experience either in research or as a teaching assistant for each of those 4 semesters in addition to your coursework.
We develop very close relationships with our students. Our program is probably the smallest of all of the ones that have been mentioned this morning. And we do that very purposely because we want those mentoring relationships to occur. Different than the other programs, and so it's important, PhD education is expensive, but here at Columbia, we make an investment in the future of nursing because we support PhD education financially for students. And what that means is that for the first 2 years of study, both tuition and a stipend is provided for students who are accepted here. That's not that different from other PhD programs in the country, but that's important to know in terms of thinking about, the expense of education. So that's, we do want you to know that. And our support for tuition covers 37 credits, which is the required coursework that we require. If there's additional coursework in addition to that, then that's something that the student is responsible for. So what do people with PhDs do when they finish? And so typically you would think in academia, in research-intensive universities, and many people do that is the role, but our graduates also do a lot of other really interesting things that you may not have thought about, in terms of nurse executive positions, work with policy agencies. We have a few of our graduates who are the nurse scientists who lead research within magnet hospital settings. So it can really be a very wide range of different opportunities. And I know when I came into the room, there was one question about what if you want to be the expert clinician and a nurse scientist? And so, and I think I'll go back just to sort of reemphasize what Dr. Honig said earlier, where your decisions have to be right for you. There are a lot of different pathways that can get to the same end, and we, as you think about yourself, we're here to talk with you and to help guide you, and we don't try to smash people into the one little hole that we think is the right hole for us. There are different ways to accomplish goals, and we'll tell you what we think the options are. We might tell you what we think is the best choice, but we also really want to help you to make good decisions.
Thank you. Good afternoon. My name is Penelope Buschman, and I direct the Psychiatric Nurse Practitioner program. I'd like to tell you a little bit about the program. The program prepares you to be primary psychiatric providers. And knowing that all of the psychiatric patients you will be caring for have comorbid conditions, have medical conditions, have other issues, we prepare you to be the primary psychiatric provider and to collaborate with your nurse practitioner and physician colleagues in terms of giving the whole care that our patients need. We do prepare you to assess very carefully, to treat mentally ill patients, providing not only medication management, but individual, group, and family psychotherapy. The clinical experiences that you will have, and you will have them in sites throughout the 5 boroughs and in Manhattan, sites that we will select on your behalf. Those experiences will put you in touch with psychiatric nurse practitioners or psychiatrists at the sites. You will have your clinical supervision in small groups of about 5 students with a practicing faculty member. So if you're in a family therapy experience, your instructor will be a licensed family therapist who is also a psychiatric nurse practitioner. So that will be the preparation. You will have an opportunity over the course of your program to make some decisions about an age group that you're most comfortable working with. Your your didactic information, your preparation will be lifespan, but you will be prepared clinically with children, adolescents, and families, or with adults and with geriatric patients. And you have an opportunity to make those decisions, and then we tailor your clinical experiences to those particular age and development specialties. What do our students do when they complete the program? They do a number of things. Some of our students do work in acute settings with psychiatric patients. As many of you may know, acute care in hospital is a relatively brief experience for a patient. Patients are moved out into the community very quickly, sometimes when they're not stable, when they're not really prepared to be in a community setting. So many of our graduates work in community sites with very acute populations of patients. Our patients are not worried well patients. Our patients are vulnerable and very ill, mentally ill patients. So we work in inpatient, we work in community settings. Some of our graduates do work in private practice, although we don't recommend that for some years. One has to be a more seasoned clinician to be able to be in a private practice situation. You will be working with a team of colleagues. You'll be working with other psychiatric nurse practitioners, with psychiatrists, psychologists, social workers, and you'll provide a part of that team care.